and happy to introduce Dr. Rassman as part of our Health at Google Speaker Series. Dr. Rassman graduated from the Medical College of Virginia in 1966, where he received his Doctor of Medicine. He completed a surgical internship at the University of Minnesota and obtained a cardiovascular fellowship with Dr. Lily High. I think I said that right. Dr. Rassman completed a residency in general surgery at the Cornell Medical Center and Dartmouth Medical Center. In 1991, Dr. Rassman founded the New Hair Institute and quickly became a world leader in hair restoration surgery and in hair transplant technology. This technology enables NHI surgeons to perform hair transplants with large numbers of grafts in single surgeries. These high graft counts were previously thought possible only with 4 to 10 surgeries. His many innovations in techniques and equipment have been presented at medical meetings around the world and published in industry newsletters and prestigious medical journals as he pioneered these advances. Dr. Rassman has presented more than 19 scientific papers before national and international societies, such as the International Society of Hair Restoration Surgery and the International Society for Hair and Scalp Surgery. And with that, I'll hand it to Dr. Rassman.
Thank you for those people in this audience, and if the people from outside of the campus want to ask questions at any time, I'm always love to be interrupted, anything that's urgent. I tend to set the pace, so I will go forward there. For those of you who've seen something about my background before I entered this field, I'd be happy to talk about dairy farming and milking cows, if you'd like, biotechnology, windmills, or any of the other things I've done, if any of that interests you. Meanwhile, of course, the focus today is of hair loss. Why do I have it? Of course, that's one of the big questions, and the most important question is, what can I do to keep it? And that is not an easy question to answer. Unfortunately, we don't have the answer that's good, that's ideal, which is a cure for balding. I have with me 4 patients. They're very distinctly different in groups, and I'll introduce you to them as we get to them in the presentation. So why is hair important? It certainly reflects youthfulness and health, and we do not want to appear unhealthy. In the days of tuberculosis, when that ravaged the world, one of the first things that men would do is they would lose their hair. And so women who were seeking men for their lives would immediately eliminate balding men. And so the history of health and youthfulness and the ability to be around to father their children, it was clearly an indicator was the amount of hair they had on their head. It's clearly an important issue for self-esteem. It's a big dark secret for very many men who are bothered by their hair loss. It's not a subject we talk about in public. I've gone to many places to talk about hair loss, and when I go to a gym where there are lots of men and lots of women, and I hold a conference there, no men show up because they don't want to admit that they are vain in the slightest way. Yet I hold these open houses in my office in which I have former patients come, and we get very big crowds there. And I always look at it as like an Alcoholics Anonymous meeting, that if you're one of the people, you don't mind joining others into the meeting, but you just don't want to be isolated as a separate person there. The hair has actual function. It protects the head from sunburns and cancer. And people who don't have any hair on their head will be frequent for basal cell carcinomas and squamous cell carcinomas. And the longer they get exposure to the sun, the longer, the more surgeries they'll have on their head for skin cancers. It is a radiator for the body's heat regulation. There's a story about when Napoleon invaded Russia and the winter came in and then devastated his army because they were poorly equipped. The first men to die were the bald men because they lost their body heat and they couldn't protect themselves from the cold. In the Africa plains, the hair becomes a radiator. So the kinky hair we see with African Americans is a radiator that allows air to move through a sweaty scalp and cool the body. So it's a general body regulator. And of course, the industry is huge when we talk about haircuts, stylists, a variety of hair products, wigs, and advertising monies. And let's take a look at hair. This is almost your ideal hair presentation. And if we zoom in and take a look at the microscopic, somewhat macroscopic view of the hair, what you will see is that the hair grows in these little clumps. And sometimes there are 2 hairs, sometimes they're single, sometimes there are 3 hairs in the clump. And we call these clumps, if you will, follicular units. It's the medical term, industry standard medical term, and you'll hear me refer to them as that. So let's talk about the causes of hair loss. The most common cause of hair loss is genetics. Of interest, about half of the male population have some degree of balding. and about half of the female population have some degree of balding. For the men, it occurs mostly before the age of 45, many of them in their 20s. And the most severe balding patterns are present in the very young men in their 20s. So the men who are going to go very bald in their life will have it by the time they're 29, most of them. While in females, the balding doesn't start showing up until they approach menopause. And when they are hit by female balding, as I said, 50% of the population are in that category. They get generalized thinning. It's a diffuse process, unlike the male, which tends to have a pattern balding. The female has a diffuse balding appearance. So there are lots of diseases that also produce balding. There are autoimmune diseases, a variety of types of alopecia, thyroid disease. There are mechanical problems, braiding, wigs. And I brought with me, if you want to hone in on my wig, I got this from a patient that I treated. He threw it out and gave it to me as a gift. And they're very hard to attach. And this particular wig has a tape border. So you shave your head and then you tape this onto the head. And this is an actual wig. So we call these things hair systems. The word wig has fallen in disfavor by the users. The braiding issue is a really important issue, again, against African Americans. I would say way more than 50% of females who have pigtails and twists and a lot of work on their hair when they're young will actually lose their hair and develop traction alopecia. And the wigs are heavily used amongst African American women. And stress is a very important factor in hair loss. I remember a man coming to see me. He lost his 4-year-old child from acute leukemia, and in the 6 months it took her from the appearance of the disease till the child's death, he lost all the hair on his head, and he became an advanced hair loss pattern patient, all induced by the stress of his child's illness. And of course, then we have environmental factors of the things that we eat, antidepressants, a whole variety of drugs, birth control pills for women will frequently cause hair loss, and particularly when they're genetically inclined or vulnerable for that. And of course, vitamin deficiencies, which are not common in America, are causes of hair loss. And there are a lot of people who are selling vitamins to cure your hair loss problem. Unfortunately, it doesn't really work. So let's take a look at a man who's going bald. And this, when you get down to the microscopic level and you look at it, you'll notice that the hair grows in little clumps, as we saw when we saw the whole pattern from above. And if you look over here, you'll see a clump on the far right of 4 hairs in a single clump follicular unit. And then if we zoom in on another stage of balding in this particular man, you'll notice that the hair is thinner and more puny. And this is what happens in the balding process. It becomes miniaturized. It loses its bulk. Its number count is still the same, but the bulk starts disappearing. And then as it gets further down the course of the balding, like in the very front of that circle, all of a sudden you start seeing that the hairs are starting to fall out and there's nothing left of the hair on the head. So what can we do about hair loss? Well, if you've got a disease like thyroid disease, you treat it. If you're anemic, you try to get to the root of the problem for the anemia. So if you pick up a deficiency, it's pretty easy to at least thwart it, stop the hair loss. It may not return the hair that you've lost. Then there is a material called concealers. And here's a patient that has a concealer on his head, and a concealer is like a powder. And here's a piece of paper, and I'm going to put the concealer on this concealer called Topic. And you can imagine what happens if you see this. I hope this shows up on the camera. Okay, that's a powder that sticks to the top of the head. You try to get it in between the hair, and this does a good job, and it did a nice job on this man. You have a see-through back, the crown of the head, and on the right, you'll notice you can't see very much because the concealer reduces the contrast between the scalp color, the hair color, and it makes them almost the same, and therefore you can't distinguish the balding. And this is very popular, by the way. The companies that manufacture these powders and sprays have businesses in the tens of millions of dollars a year, and a lot of people are using them. The problems with them, of course, is that the powder falls on your shirt, your blouse, and you have a problem on how to fix it there, and that's one of the issues. Okay, of course, I'm in the business of a hair transplant business, and that means that we move hair around the head from one place to the other. And here's an extreme example of a man who has the most extreme form of balding. This is what they call a class 7 balding pattern. And if you look at the right side, you will see the clumps of hair here have more hairs per clump, more follicles in the follicular unit than we saw in the previous patient example. And these follicular units, this man had one of the highest counts that I have ever made, and as a result of that, you can see he was all bald, and I was able to put back a full head of hair on him in a series of surgeries, and he had a fantastic result. And this is highly unusual to have this type of donor supply. The hair transplant business is a supply-demand issue. If you have enough supply, you can meet the demand. If the demand is low, it's very, very unusual for a man like the one in the picture here to have his demand met by the supply of his hair. And when you count the average male, Caucasian male, has about 100,000 hairs on his head. This man had about 200,000, so he had a lot of excess hair that could be moved around. Amongst the races, the hair densities vary. Amongst Caucasians, there are 100,000 hairs on the head of a typical of Caucasian in a standard bell curve. If you're an Asian, it brings the count down to about 80,000 hairs. And if you're African, you get down to about 60 to 65,000 hairs. So the amount of hairs on your head decrease, and it is somewhat racially dependent. Okay, now, since we pull out these follicular units that I was talking about and we move them to the top of the head, if you look over here, this particular patient had had 2 types of extractions. One was a strip where we actually cut out a piece of scalp, sewed it together, as you can see where it says trichophytic closure, and there's a little bit of a white scar. There's a bit of a white scar but it barely is noticeable on this patient. He healed very well, and this particular type of closure surgical technique has minimized the scar. And then below it, we actually removed them with a punch. So there's about a 0.8 millimeter or a 0.9 millimeter punch, sharp circular punch that gets cores out these follicular units, and then you move them to the place that's balding. In the old days, when hair transplants were first started up, the punches were the size of a pencil. And you could imagine if you took a pencil-sized punch and you put it in your bald head, you look like you were pluggy. And of course, that gave hair transplant a pretty bad image for many decades, actually, since it was conceived in the mid 1950s. And here's a young man that had 600 follicular units, these multi-haired units placed in his head, extracted from the back of his head, and we did not shave his head. We only shaved little strips. And then on the right, you can see that the hair combed over it, so you really couldn't see it. So here are the strips of the areas that we shaved. The hair follicles were removed from here and then placed in the front of his head. If anybody has any questions about this or wants me to slow down or something like that, please speak up. I'm just scanning the audience on that one. So what is it that we take out? Well, we take out a follicular unit, and this is a follicular unit. On the right, over here, you will see what the actual follicular unit looks like when it comes out of the head. And this one has actually two follicles in it. One of the follicles is actually a baby follicle that's in the state of growth. The other one is a mature hair follicle, so this is what we call two-hair follicular unit. And the anatomy, you can see, is a bit complex. The hair actually grows someplace over here, right underneath the sebaceous gland is the growth center for the hair, and the rest of it comes from the bulb. So the hair has got two different growth centers, and when it regrows, it regrows from contributions in both places, the dermal papilla and right below the sebaceous gland. And here's a typical patient that we did. This man is fairly well known. I won't tell you in what circles, but he had a very dramatic change in his appearance, and he loved his work. And here's another man who was thinning. There wasn't much hair left on his head. And you can see the change that occurred in his hair transplant. And this is Mark, who I'm going to ask Mark and Fred to come up here. Mark, come on up over here. And Fred, you can join him because I have pictures of both of these men beforehand. And I can have Mark, you can take the mic.
Sure.
And we'll keep this, so 1 second.
There you go.
Okay, and they can talk a little bit about their experience if that helps. Get you away from me. Go ahead, Mark, you can start.
Okay, well,
Mark's a showman, I just want you to know that. And that's
Yeah.
what he does for a living, so.
I've been in rock and roll basically all my life. Toured all around the world during the 80s, did all the big hair, was in a big hair band. Toured with a lot of people that you probably were listening to when you were 10 years old, and I was out there trucking it, and I'm still doing it. And about 6 years ago, my son, we were swimming, and I got out of the pool, and he said, "Gee, Dad, you're bald." And I go, "Really?" And I looked in the big plate glass window, and I, oh my God. I always combed it forward. I didn't notice. So I went out looking around like everybody, when they find something they really want changed, they start actively searching the web and everywhere else. And you go and you get interviews and all this stuff. And I lucked out. I was coming back from a gig, and I heard about an open audition for Extreme Makeover. Remember that show? The home makeover is still on, but it started out with making the guy or the girl over. And I said, well, I'm not ugly, but I'd really love to have my hair done. And I went and I was interviewed, and I auditioned for it, and I got on the show. I couldn't believe it. And the first thing I asked them, I said, "You can do anything with this you want. Fine. I need hair. And they said, well, we'll think about it. And they said, sign this contract. It's about the size of the Webster Dictionary. And I said, okay, sure. Bing. So the rest of my life, you can go on YouTube or Google me. It's Mark Strong, Marque, and you can find everything he did to me. This man changed my life. And I've enjoyed it ever since. So the first time I went in, it was 4 days before the airing of the reveal for the show. He did a 1,300 count transplant, and they cut my hair real short, dyed it brown, and put me on the show, and you would never know it. We can go into detail, and he can go into
That's because you
detail.
combed your hair forward and covered it up.
Not for the show. For the show, they had it all real short and a big family.
I look at Mark like Samson. You know, he lost his hair and he lost his strength.
Yeah.
Okay,
Nah,
Mark lost his talent when he didn't have his hair, and now he feels more creative than ever since he got his hair back. And there really is a lot to it. A lot of patients that I've done believe that I am the one that's responsible for their careers because they didn't have the self-confidence necessary to do what they wanted to do, and then made it nicely in the world of acting or whatever.
Well, he's absolutely talk about his experience, so go for it.
Yeah, sure. In my case, I had general thinning, and my hairline had gradually over the years moved back to the point where I was just all forehead. The hairline was probably about halfway back on my head, 3 inches farther back than where it currently is. I was also thinning in the crown, and in fact, when I first visited Dr. Rassman, I actually talked to him about transplanting in the crown, and he advised against it at the time. I said, look, you only have a limited amount of donor hair. Let's save that for the front, and also let's get you on Propecia. Let's see, your crown's not too bad yet, and you might have a chance of getting some recovery. And I started Propecia right away, and after being on it for 4 or 5 months, I did get a good recovery on my crown. Their hair hadn't completely died. It was becoming miniaturized and thinner and kind of transparent. But that, after being on the Propecia, it regained its health and thickened up and got its color back. And so I never did have to do anything in the crown. We did transplant the front. I've had 2 surgeries. The first transplant, we did 2,800 grafts, which really was a dramatic improvement, filling in the front. And then the second surgery, which I did a few years later, we hit the same area again with about half as many grafts, about 1,300 grafts a second time, just to thicken it up and give the density or the thickness in front, get it a little bit more consistent with what I have in the back. I've been on Propecia now for about 5 years. I've had no negative side effects from it. In fact, I've had a positive side effect in that it's also a medication that shrinks the prostate in men. At 50 years old, it used to be that I was getting up in the middle of the night to use the bathroom once a night, and after being on the Propecia for a number of months, it shrunk the prostate down. I don't even have to get up in the middle of the night anymore, so that's been a nice side benefit.
It probably pays to mention something about Propecia. It was on my agenda, and I'm glad you talked about it. About 14 years ago, Merck released the drug Propecia, which is finasteride, the drug finasteride. It was used many years before that for the prostate as well, and they did notice that it would stop hair loss, and in young men it might even reverse the hair loss, particularly in the back of the head, not much in the front. And that's a critical drug that I try to ask all men, not women, men only, to go on the drug. There are teratogenic effects of women. Teratogenicity means that there are side effects on babies that they produce if they're pregnant, and therefore they ask women to stay away from the drug, particularly women in childbearing age. The other drug that's available is a drug called minoxidil. Rogaine is the commercial version of it, the brand name, and that's not quite as effective. It works okay on women. Maybe 15-20% of women will get a benefit from it, and men about 10 to 15% will get a good result from it. It is an addicting medication. If you get benefit and you stop it, you will lose it. If you stop Propecia, you will lose your hair that was saved by the Propecia. So for the men, it becomes lifetime commitments for the Propecia in particular.
I wanted to bring up one other thing that we talk about when we are having your open houses in your office, which is really nice. He's one of the few doctors that I've ever met that invites people in to meet previous patients and discuss things informally, and that's kind of like what we're doing here. So any questions you have for any of us, or if you want to come up and pull and grab the hair, that's fine. It's our real hair. But here's one thing that we talk about. When you take it from the donor area, which is your best hair, and it's DHT, not impervious to DHT, but DHT attacks it a lot less, and you put it in the front of your head, well, the number one thing that I've noticed is that now you have the healthiest hair on your head right in the one spot on your head that is the weakest. So all of a sudden now you got great hair in the front.
The hair in the back on this particular man that I'm showing you, it's a rim of hair 3 inches high that runs above the ear, around the side of the head, the back of the head. And this hair is never balds in men. For reasons that nobody really understands, there are theories as to why that happens. But other than for the American Indian, that all the other male populations on Earth have balding, with the exclusion of the American Indian that came out of the Alaskan Bridge. And there's some theories as to why that happened as well. But this permanent rim on Victor here in the picture is the permanent rim that donates the hair, and that hair behaves like it did in its original site when you move it.
And it grows really fast, so you got to trim it all the time. Even I trim my hair. Doesn't look like it, but I do.
There are no plugs anymore. Anybody with modern technology, you really can't tell a hair transplant from a normal head of hair. And I would defy anybody in this audience to look at these two men, or myself, who's been transplanted, and the whole back of my head has been transplanted. And I would defy anybody to show that they think it's artificial, or it wasn't my own hair, or God hadn't intended to put it there in particular. Any questions for these two men before I bring the other two guys up? Okay. Yes, go ahead. Was there a question here?
No.
Okay.
Now you good? There you go. I see.
Go ahead.
So have you experienced hair loss since the transplant? Does that happen?
No, I have not experienced hair loss at all since the transplant. Generally speaking, if you're over 40, 35 years old, most of those people are stable. And if you take Propecia, it's almost certain to be stable. The big problem patients are the people in their 20s, early 20s, mid-20s that have a lot of loss and who have very aggressive hair loss patterns. But you learn to create what I call a master plan. And the master plan takes into account the worst case, the best case, and the probable case. And if you can't handle the worst case, you shouldn't do anything about it and just let nature take its course. But I think that's an important question. Stability does occur as you get older. It's unusual for a man to start losing hair at the age of 40, 35, 40. It does happen on rare occasion. The famous actor Don Amici started losing hair when he was 50, but that was an exception to the rule. Yes, Mark?
I was going to say, again, my son says, you shed all over the place, Dad. And I go, yeah, I've always been that way. So a lot of people worry that, there's a certain amount of hair in my brush or whatever. Everybody does that. But it's when you are shedding more than you're growing, then that's when you know you have the problem. All I could say is there is that shock loss right after the surgery, which we talk about in the office, which a lot of people ask about. And there is a certain amount of that where you will lose from the original area, and then it grows back. That's why it's called a shock loss, because it's...
But this condition can be prevented by just being on the drug finasteride, Propecia.
Yeah.
So for most, let's say 90% of even young men who are on the drug before they have a hair transplant, they can hold their hair pretty well and they won't develop shock loss. He just pointed out an important issue is that hair goes through cycles. You don't grow a hair and then it stays there for the rest of your life. You grow a hair 2 to 3 years at a rate of about a half an inch a month, and then it falls out and gets replaced by another one. And this cycling from growth to resting phase occurs over an average of 3 years, 2 years in men, 3 years in women. The story of the brothers Grime, who wrote the story about Rapunzel, talked about the princess up in the tower, let down your golden hair so the prince can climb up and rescue her. Well, the hair never gets that long. The most the hair can grow is probably about 5.5, 6 feet, and then it'll fall out and grow another hair. The good news is it occurs at about 100 hairs a day on a Caucasian, and it grows in at a rate of 100 hairs a day, so that there's a big wash between what you lose and what you gain. What you see in the drain, the hairs that you see in the drain, is really the 100 hairs a day that you're going to lose. If you get an acceleration of that may be balding. Yes?
Talk a little bit about the recovery period, the amount of pain experience, how long it's going to get back to
Fred?
Sure.
The question was how much pain is experienced, what's the recovery like?
Yeah, in the strip method, the only field were it's in the back of the head where they actually extract the section of skin and then close it with the sutures. And the surgery itself is not at all painful because they numb you up. You might have a little bit of trouble sleeping the first night, but they give you some medication to help with that. But by the day after the surgery, I was completely off the pain medication. Never felt anything up in front where the hair was transplanted. Only in the area where we extracted the skin strip and closed with sutures. Had staples for about 2 weeks to keep the suture closed, and then had those out. Just a little bit of numbness in the back where the strip was taken, and that eventually goes away after several months. There's a redness initially up on top where the new hairs are transplanted. That redness generally goes away in 7 to 10 days.
I personally found that I had a little bit of swelling around the forehead and just cold compresses. They always plead with you to come in the next day to have them shampoo your hair and show you how to take care of it properly for the first week. I always equate it to like planting tulip bulbs in the ground. You can't just hose it down with high pressure hose and expect the bulbs to stay underground. Everything has to have a nurturing point, and then it's so negligible. I mean, he just gave me a couple of Xanax, and I'm sitting there listening to him, and he went through the whole procedure, and I was fine with it. And I've had 3 procedures, and every one of them has been exactly the same. And the recovery period is according to your skin color, your hair type, and how easily you bruise, that kind of thing. But for most of us that heal fairly easily, the recovery period is very, very quick. The body comes back really quick, and then you will notice hair growth within 3 to 6 months.
Yeah,
I noticed
it
it
about 4
almost
months.
immediately.
What was that, Fred?
Yeah, for me, it was there was about a 4-month dormant period where nothing was happening for the first 4 months, but then it started coming in, and then it really came in quickly between month 4 and month 8. But even a year and a half out, I mean, it was still some stragglers kind of coming in, and also even the hair that had come in early was thickening up over time and getting more healthy.
Yeah, and I color my hair. And I've known Fred the whole time he's been going, and his hair, if you get really close to it, it looks like a 20-year-old hair. And he's amazing. There's a couple other guys, Moses and a couple
Okay,
others.
there's another question.
So if I'm losing hair, should I wait till the hair is gone and then do the implant, or while I'm losing hair, I can do the implant?
Well, it's a good idea to catch it early, because then you can stop it with the drug, and then you could put it back, and hopefully that'll take care of it. So that's the best of all worlds. Yes, another question.
Can you talk about the
I have just polled a number of doctors that account for about 10,000 patients over 20 years. And the numbers of cases that were reported of irreversible sexual side effects, meaning loss of libido, erectile dysfunction, was about 4. So use those as statistics. It does happen. We didn't recognize it before. The drug company has not been forthright at coming forward with that as a side effect, probably because it didn't fall within the statistical range that they have required reporting. But it's still rare. And most of the time, if you develop sexual side effects, you work with a good doctor, and you can deal with those sexual side effects pretty well. Yes?
Just make sure you repeat the question.
Oh, I'm sorry. That was on sexual side effects and how often do you get irreversible sexual side effects. Sexual side effects itself is about 1%, 1 to 2% reported by the drug company Merck. In my experience, it may be a little higher, maybe 3 or 4%. But the irreversible, I've done thousands of men, put them on that medicine. I've never seen it for those people that have stopped it. And that was true amongst the 6 or 8 doctors I polled. If you go on baldingblog.com and just look up sexual side effects, you'll see the statistics that were done by the doctors that I polled, specifically to answer a question like that from the audience. Yes?
And with the Propecia, how long before you see the effects of the drug? And later on, now for a second question for you guys, can you cut your hair very short and find that it just grows back, or is it something where now that you've got them in, you need to kind of?
Well, let me answer the first. The Propecia effect. Remember, it might work within the first week or two, and it probably does, but it takes time for the hair to grow out, and it takes a bit of exposure to Propecia to see it. So we tell about most people I start on it that don't intend on doing any surgery to basically wait a year, 8 months to a year, to see what the effects are. They are very subtle on the front of the head, and they may work in the crown, and you'll know whether you're a responder usually in 8 to 12 months.
Yeah, I will tell you that for me, it was 4 months on Propecia before I saw noticeable results, both in terms of recovery in my crown, getting thicker, healthier hair, and also about the same for the shrinking of my prostate, which I talked about.
There was a friend of mine that I sent over, and he's going to have the hair transplants done now. And he actually met with Dr. Rassman 15 years ago and got on the Propecia. And he's had hardly any hair loss, he said to me before I ever sent him back to Dr. Rassman in the last 15 years, strictly because of he stayed on the Propecia. He has hair loss, but it was all there 15 years ago, and it has not progressed. And he said, I'm finally ready. I've got the cash. I'm ready to go in. So
Yeah. To answer your other question, if you shave your head, it'll grow out at a half an inch a month. Okay. So
Yeah, it acts just like every other hair on your head. There's no difference at all.
we talk quite often, and there used to be a gentleman that would come into the office, and he had long hair like I did, and he was an extreme sports guy, and he had a lot of balding all the way back. Well, he had Dr. Rassman bring his whole where his hairline was down even further than it was originally, and then he joined the Navy SEALs, and now he shaves his head. So it still grows out just fine, but he keeps it really
But you
short.
need, not everybody will get the same result, and that's why you need a good doctor to work out what is the plan, what are the expectations, and to set realistic expectations always. That's important, because what's good for one person may not be good for another one, like anything in medicine. That's the standard. Any other questions? I'd like to call up the other two guys. Yeah, is there a question in the back? Oh, okay. All right, if you guys will step by, we'll have everybody open to this in a few minutes. This is Jeremy coming first and Tony behind them, and they've had an unusually different type of a procedure that has just been introduced by our company, and this is, we call it scalp micropigmentation. It's a fancy name for a tattoo, and it's to try to make it look like it was there forever. And it's like a stippling effect on the head to reflect every hair follicle that was there. And both of these men were class 7 patients. So here's Tony beforehand, and this is Jeremy, and Jeremy and Tony both had class 7 patterns. And if you remember what I told you earlier about a class 7 pattern, this is a class 7 pattern. So they were almost to the class 7 patterns, but much younger. And if they waited it out, they would look like this man. I don't mean to scare you, okay? I don't know whether I told you that.
Pretty much already was.
Anyway, Tony, you're the first one on the picture, so why don't you go and talk. How the hell, pardon me, how did you make this decision to go do this?
Hair loss is a very sensitive subject for most men and anyone in general. And I started when I was quite young, and I didn't want to accept it. So for the first couple of years, it was more of a denial phase. And then there's a reality that sets in, and you just don't have a choice. You're gonna be bald the rest of your life, basically. And so I just said, screw it. I started shaving my head pretty young, and I didn't have a problem with it. Went through college and stuff, shaved my head, and just looked at it like that. That's how I was going to be the rest of my life. And then I started thinking one day, what if there was some way to give it the illusion that I had a full head of hair, but it was shaved, because I shave it anyway. What's the difference? I can't look any worse than I already do, you know? So I just kind of went down that path and did some research, and came across micropigmentation. Now, the thing is, what it did is it changed the focal point of my face, and it's more of a personal thing. Honestly, there shouldn't be anything wrong with going bald. It's more like a personal thing. Society might look down upon it, but as a personal thing, it's like a breast augmentation. You know, do you want to get it done or not? You want to feel better about yourself. It's going to make you a better person in general. People might look at you different, or something like that. And so it was a personal thing, and it has changed my life greatly in different aspects and stuff. I can't say that I wasn't unhappy with how I looked at all. I really wasn't. My wife loved me the same, with or without, and it was just something I chose to do, and it's made a good impact on my life, and I'm very satisfied actually with how things have gone. The hairline, as you see, I've had it done quite a while ago. If I was to redo it, I might do my hairline a little different or something, because why guy with a full head of hair bigs their head, right? Well, it's more of a choice thing. Most guys that shave their head don't do it by choice. It's because they're losing their hair and they don't want to look like it, you know, with the round thing going around the sides and whatnot. Anyway, that's kind of my story, why I went with it. Dr. Rassman is by far the best in the business if you're looking to get a hair transplant or this micropigmentation. If you have, there's guys that do wear the hair pieces. They, as Dr. Rassman brought up, they weave. I'm only knowledge of this because I researched it. They let the hair on the sides grow out, and then they weave it in. So every month you're going in, and they get this thing tied down. Well, there's a lot of guys that do that, and they can get those taken off, and then he can do the micropigmentation, and you go into work a week later, and it looks like you just shaved your head. And honestly, I just saw one of my best friends I haven't seen in like 8 years 2 days ago, and doesn't have a clue. I see my friends I might not see for a certain amount of time, and they literally don't even notice. It's not like it's a drastic change to them at all. They don't even realize it. And it's so what's the word I'm looking for? Honestly, people just think you just shaved your head. I get questions at work, oh, you decided to let your hair grow out, or I've even had the question, did you get a hair transplant, or how'd you do that? There's curiosity things. Most of it is from other guys losing their hair, because they knew I was losing my hair prior. This was at work, a lot of guys, and they're like, what'd you do, and stuff, and it's kind of tough to explain. It's quite a story, obviously, but yeah, I highly recommend it. If you're thin and on top, you can get the hair transplant, of course, but it'll also thicken up everything on top and give you a thick peel.
If Tony, for example, wanted to do a hair transplant, but if he had a density like an Asian or or an African density, and he didn't have a lot of donor hair with a class 7 pattern, you'd never get enough hair to transplant his head.
Yeah, my hair is really thin as it was anyway, so even if I wanted it done, there's pretty much no way that I could even do it. I mean, maybe in the future when they have an unlimited amount of hair because they can clone it or something, maybe go down that road. Who knows?
And I'll address that at the very end. So let's okay.
Anyway, go ahead, Jeremy.
Go ahead, Jeremy.
Hi, my name's
Jeremy. Talk a little bit about what happened when you went to work, because you recently did it, and you can talk about the
unlike
experience.
Tony's had it done almost a year ago now. I had mine done about a month ago. I had it done on a Thursday, and I took off Friday and Monday, so I had a 4-day weekend to recover from everything. And when I say recover, we're not talking anything like a hair transplant. It's really, I was sitting in a chair, I watched the movie on my phone, and it took about 2.5 hours, and it's like somebody giving you a tattoo on the top of your head, little tiny dots all over the top of your head that, like Tony said, like Dr. Rassman said, it replicates the look of actual hair follicles. I went back to work. I've been working at the same job for 12 years, so these are people who see me every day, day in and day out. I went back to work. A couple people said, just like Tony said, hey, are you shaving your head like with a razor now? And I said, yeah, that's what I'm doing. And a couple people said, are you growing your hair out? And I said, yeah, that's what I'm doing. Like, whatever you say, I'm going to agree to. And it was really a seamless transition. And again, speaking as somebody who was also class 7, if you guys would have seen me a month and a week ago, I had a full clear line through my head. If I would have turned around, you'd have seen the cul-de-sac and everything. Even though I kept it really, really short, that's what was there. And you know what? Like Tony said, it's not something you should be embarrassed about necessarily, but a lot of guys don't like it, and I was one of those guys. I felt uncomfortable about it. I realized I was going bald, I think, 5 years ago. I was in a Kohl's dressing room trying on a pair of slacks, and came out, and there was mirrors all over the place, and I saw the back of my head, and I thought, oh my gosh, like, what's happening here? And from that point on, immediately, self-confidence shot down, and just, didn't feel good about myself. And so been looking into a couple things. I'm not trying to do a hair transplant. I kept my hair short anyway, so I was thinking, of something else, and I didn't know of anything else until I ran into Dr. Rassman, and he said, you know what, you would be perfect for this scalp micropigmentation thing coming out. I looked into it, saw some things on the internet, looked to be too good to be true, like a lot of things on the internet, right? My dad always taught me if something's too good to be true, it usually is. I insisted on meeting somebody who had it done. Dr. Rassman brought Tony in. I met this guy. I'm looking at his head. And I'm like, I'd have no idea that that's not real hair. That, you know what, if you let that grow, this guy's going to have the thickest head of hair ever. But he won't.
And that's not something, and that's not something you want to do, by the way. You don't want either of these men to let their real hair grow, because then they would have a runway in the middle of their head that looked shaved, and then they'd have bushy hair around the side and back of their head with long hair, and that's not what we think is a normal look.
And you don't have to bick it. We bick our heads with the razor. It's less noticeable, I guess. You can honestly do it with a low razor setting, and it can just look like a trim look. Use a 0, or I used to use a 0 actually, but started bicking it, and I just like it much better. This is all real, all around the sides. Only the top up here is done. I don't know if you can see it with the lighting and stuff, but.
And at the end of this, we can have you look at all these 4 gentlemen when we move into the informal place. Are there any questions here from the audience about this? Okay, this is very new, and we're just starting to build the patient numbers here, and it's been nice and satisfying. Yes.
If I can jump back in, I think the thing about the scalp micropigmentation is that it doesn't have to be somebody who's, hey, look at my head, I'm going bald, so I'm going to do this. I think if I would have known about this prior, if I was a guy who was losing my hair, but I still had some hair on top and it was kind of going away, you could literally take a day off, have this done, go back to work 3 days later, and now you're the guy who shaves his head and appears to have a thick, full head of hair, and nobody knows. And that's really what it comes down to. Is I think I didn't want anybody to know that I had something done. That's probably the most uncomfortable thing. Is that you don't want people to know that you've had a hair transplant necessarily. You don't want people to know that you're uncomfortable about this part of your body. But again, I think this could go kind of across the board. Anybody who's looking to have something done, if you decide, you know what, I'm going to start shaving my head from this point forward, keeping it short. Get something like this done, and it's just, again, seamless transition. People don't know it's there, and now you're the guy with the short haircut.
And it works wonders for people who have scars on the back of their head or any place on their head. It can make the scar go away. We do it in conjunction with hair transplants when people get enough hair, and then they just fill it in with this pigmentation. So it's a very interesting blend when you work the hair transplant with the pigmentation. Okay, Minna? Okay, I have, yes, no more questions. Okay, yes, go ahead.
So for women who are thinning, have their hair is thinning, and they can't take Propecia, what is there something else that you can do for them, or is the transplant good to go?
For women, minoxidil works, not great, but it does work a little bit. For women, you want to make sure that you've had a full medical workup, that you're not walking around with hormone deficiencies or a variety of diseases like thyroid disease or anemia. So the first thing we do is go through a thorough, or recommend that the patient has a complete, thorough medical workup and laboratory workup. But by and large, there isn't very much we can do. We do transplants on women. About half the women that we do are women that have had facelifts and cosmetic surgery. It works great for that. And the other half are women that have more pattern balding, like a male, which is about less than 20% of the women that have balding. And sometimes I can actually transplant a woman if we work out a style that they want to fix on their head. I can put hair in that area, like parting the hair in the middle. I can, cover an area maybe 2 inches by 4 inches and put hair there. And that works for women. The big problem with women is that the hair in the donor area, this fringe area that I showed you on the man before, is usually not healthy. So it might have miniaturization to 40 or 50 or 60% of its original population, and that's moving bad hair to bad hair. So you have to be highly selective. I would say only about 20 to 30% of women have value with having a surgical procedure like a hair transplant. We have been doing a few women with scalp pigmentation in between the hair. And that's worked very nicely on selected women to thicken it up so it doesn't look as thin. And I think that'll have a nice, bright future in our practice. Yes?
Any validity to biotin being effective? Biotin, any validity?
Is there any validity to biotin? No, there is no validity to that helping. Well, most of the claims on a variety of vitamins and medicines are just not true. And unfortunately, there's a lot of people get preyed on by a lot of not good marketing material, and there are scams all over the internet. And of course, a lot of people buy into these scams, unfortunately. So if you see a good doctor, they'll tell you that's not good stuff. Don't waste your money. And if you read my balding blog, I have that all over there. People will ask questions constantly. Will this work? Will biotin work? You can go on balding blog and ask the question about biotin. I've answered it already before for other people. Yes?
What about cloning for women?
Okay, let's talk about cloning. We just started a study in our office. We just got an IRB, an Institutional Review Board's ability to do human experimentation. And that is with hair multiplication. We've selected the population that we want to do it on. They have to have a big bald area. And what we do is we pluck hair out of the back and side of the head, pluck. And the hair that you pluck out will regrow. And then you put it into the front or the back or the bald area that you're targeting. We've been doing 100 hairs per area, and sometimes 200 or 300 hairs are placed in maybe 2 or 3 areas. And we have just started this about 3 to 4 months ago. I'm getting all the patients to come in now. I have not seen any growth yet. I wouldn't expect it if I did hair transplants either at this stage. But maybe in 3 months I'll have answers on that as to whether hair multiplication works. There is some evidence by one doctor in North Carolina that indicates that he's had success with it. And I know what he did, and we're just doing the same thing to validate the study like any good science. You want the study to be replicable in more than one institution, in the hands of more than one doctor. And that will put credibility to it if it works. If we get a failure of this, all the patients who volunteered for this have agreed to realize that, one, it's a completely experimental procedure. I don't charge them for it, and it's free basically to do it. So we're just doing this to learn, and the people just lined up as soon as I announced that I would be doing this on an experimental basis. We were swamped with people wanting to be experimental subjects. And of course, most people had too much hair for that. I want absolutely bald areas. Thank you for the question.
Yeah, men and women though?
Well, I haven't done any experimenting on women yet, but there should be no reason why a woman wouldn't respond the same as a man here. Okay, I would invite those people who are here to come down and meet these gentlemen, and you may test to see whether you could tell they're transplanted. If you want to run your fingers through my hair, you're welcome to do that too. Thank you very much for inviting me here.